Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode. Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
So animal chiropractic, we're looking for muscle tone, and we can have muscle tone that's perfect, muscle tone that's too tight, and muscle tone that's atrophied or too loose. Think of it as somebody was coming to tune a piano. You can have sharp notes or flat notes or notes that are just right. Now me, I can't tell you if my piano's in tune or not, my guitar strings are in tune, but it doesn't take an expert piano tuner very long to figure out which notes are out of whack, how to correct them so that the piano can play a nice tune. That's the way it is with your animal chiropractor. You know, a good animal chiropractor is going to take 3 to 4 minutes to figure out the tone in your animal's body, figure out which ones are too tight, which ones are too loose, figure out which ones are atrophied, figure out which nerves are causing the problem, what exercises you need to do to get those atrophied muscles up so that they're, working properly, where you need to put the ice so that you can relax the muscles that are too tight. You know, one of the things people ask me is, what about a muscle relaxer? Well, if we have a tight muscle right there in my hand, you can see this muscle right here is tight. It's tight. If I take a generalized muscle relaxer, it's going to, and guess what muscle is still the tightest muscle in my body? This one right here. Okay. May not be painful anymore, but it still is the tightest muscle. Not going to help my spine hold its alignment right. So generalized muscle relaxers don't work very well with the chiropractic adjustment. In fact, they make it hold less longer. So we highly recommend that the anti-inflammatory you use is ice, because it is the most specific, localized anti-inflammatory that there is. Every time we give a pill or a potion, it's affecting all the muscles in the body, which include the muscles of the heart and the muscles of the intestine. So, it's kind of hard to have a functioning animal at optimal level when the heart, the gut, and then the organs are working up to high level. So see your animal chiropractor on a regular basis.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Helping others experience an abundant life with the gift, art, and blessing that is animal chiropractic is our sole mission at All Creatures Every Spine. It's what we do. It's what we love. It truly is what keeps us motivated to help people just like you. I truly love the art of chiropractic. It drives me to provide the highest level of chiropractic possible And as fellow chiropractic business owners, it's that love that drives us to become better. However, the reality is that sometimes running a successful business can be challenging. Sometimes there can be obstacles to overcome. We all know the old saying, if it were easy, everyone would do it. Well, one thing that is really easy is marketing our clinic with a professional animal chiropractic website by the Chiro Website Pro, Tony Seymour. He's a professional web designer, and his team at Chiro Website Pro take good care of us. They simply make marketing our practice 100% hassle-free. If you're looking for the number one hands-free way to market your practice, give the Chiro Website Pro a call at 423-779-4630 or simply visit www.chirowebsitepro.com and make sure you ask them about the special ACES discount and let them know Dr. Amy and Dr. O sent you. You'll be glad.
Standard Process is a third-generation family-owned company in rural Wisconsin. You could say we just make nutritional supplements, but we know we're changing lives. We grow ingredients on our own certified organic farm without pesticides or herbicides because we think they should be as close to nature as possible. Quality is our priority. That's why we do everything right here, from hand-picking the seeds to delivery, so you know exactly what goes into every bottle.
Your active dog needs more than water to rehydrate. Replenish Dog Water Supplement is an all-natural powdered water flavoring, prevents dehydration and provides vitamins for your dog. Created by a veterinarian and rooted in science. Give your dog the care they deserve with Replenish.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
Hey, welcome everybody to another episode of Animal Chiropractic Clinic Chatter. I'm your host, Dr. O. Today we're here with Dr. Debby. Tell us a little bit about yourself and your practice.
Hey everybody. I am a veterinarian and a physical therapist, and I just finished my animal chiropractic course at ACES. It was amazing. I also do veterinary acupuncture. I did that course at CSU a long time ago. So I had been using acupuncture in my toolkit, if you will, and physical therapy. Since I am a human physical therapist, it just kind of transferred over. And I had taken a break from my clinic and hardcore veterinary medicine, was doing some relief work while my daughter was growing up. She is now 17 and in, high school / college here in Gunnison, Colorado. So I have more time on my hands, and I started working at a veterinary clinic here in Gunnison. Everything, definitely a mixed animal practice, and very busy, emergencies, on call all the time. And I was finding myself getting frustrated with seeing patients repeating all the time with the same problems: ear infections, itchy skin, lameness in the hind end, that the typical things we do, carprofen and gabapentin, weren't touching. And I would see some for some acupuncture and be able to maybe advance it a little bit, but they'd still keep coming back. And I realized that that sort of veterinary medicine was not for me, and I needed to find a different path. And someone had mentioned chiropractic to me. I had been thinking about animal chiropractic care on and off over the last several years, and thought, oh gosh, I can't go back to school again. I've already done so much schooling. Oh my God, what am I thinking? And I realized I needed to take the plunge. I needed to do something different, or else veterinary medicine was not going to work for me. Taking care of the animals, which is something that I dearly love, and I do think that this is my calling, wasn't going to be the place for me. It was taking too much of a toll on my mental health, general/emergency practice. So I started looking around for some animal chiropractic courses to see what would work, what would fit with my schedule, and wasn't getting any results from the emails and phone calls and voicemail messages I left until I reached out to Dr. Amy and Dr. O at ACES on a Sunday afternoon, no less. I want to say it was like 4 o'clock in the afternoon here in Colorado. So that's a little bit later in Texas. And it was in an email, just reaching out, need some information about your course. And dang, if Dr. Amy didn't call me back 2 hours later on a Sunday night and be ready to chat with me about everything that ACES had to offer. I signed up that night. It was in January. I went to my first lab in April when I got back from the Iditarod. So it took me a bit to get there, and finished up in June. Took my certification exam with AVCA just a couple of weeks ago. And now I'm adjusting animals. It's great. So I've started my own business, Burnett Animal Chiropractic, mobile chiropractic care, veterinary acupuncture, and animal physical therapy. But as you can see by the name, Burnett Animal Chiropractic is the top line.
Yeah.
So that's me in a nutshell.
Oh, cool. All right. So Dr. Amy, what does she have to say?
That first phone call, man, she was like, hey, yeah, this is Dr. Amy at ACES in Texas. And we would love to talk with you about this course. We're just, and then she kind of explained that there are 3 different modules of online courses. And then you go for the first lab and then the second lab and the third lab. And she would just be so excited for me to join and extolled the virtues of animal chiropractic care. Like I said, I got off that phone call with her and immediately signed up that night. It was just so, I think what it was, again, I'd been kind of thinking about animal chiropractic care for several years. And I had some classmates who became certified. They were on the track, so doing a lot of equine work. But again, I just thought that was out of reach for me. And Dr. Amy made it seem like this would be the easiest thing in the world for you to just move right into, and you'll find your home with like-minded people.
And
I did. Holy cow. It was amazing that the very first weekend for lab 1, I didn't even know Dr. Amy and Dr. O. I didn't know you guys, right? Except for some back and forth on Slack, as I was going through the first module of the online courses. But I got out of my car and I felt like I'm home. I mean, immediately it was like, oh, I know you guys. These are my people. These are my people who feel that there is a better way for veterinary medicine to help heal the animals in our care, that it is not just a cookbook recipe for itchy skin, that if we look farther and look at the animal as a whole and then use our hands to make some differences in their life, we can help them achieve better health. And it felt like I was coming home. That's the best way to describe it.
cool. All right. So you're out. What's your biggest win so far? I know you haven't had a lot of time yet, but what's your biggest win with animal chiropractic?
Oh, wow. So 2, one is a Labrador, 5 years old. His name is Gage. And I got the call from another veterinarian in town who we work very closely. She has a house call only practice for hospice / senior care. So, kind of some different things. She uses cold laser and she knows what I do. And so she called me because she got a call that Gage was a 5-year-old lab, took off after a bird and collapsed and couldn't use his back end, couldn't urinate, couldn't defecate, couldn't use his back end. So I went out to see him. I adjusted his atlas because that's what you're supposed to do always and forevermore first. And then I did adjust his sacrum. He was pretty sore in his sacrum. So it was just those two adjustments the first time. And he is now walking. He is using his left hind. That's the last one to come along, his left hind leg. And he is doing fantastic. And that was after the owners had taken Gage on a Sunday evening to an emergency vet here in town, and we're told that he would probably never walk again, and he would need to be euthanized, or else they could go 4 hours to the Front Range for an MRI and maybe a neurologist to do surgery, which would be tens of thousands of dollars, a lot of money. And that was what traditional medicine was going to be doing for them. So the fact that Gage is now up and walking and bringing me his toy and going for walks and just got a little bit of weakness in that left hind, that's a huge win. Testament to chiropractic care right there. The other one was a horse that I saw for 3 visits. And because that's what I told the owner when he first called me, I said, we're going to try this for 3 visits. He was intermittently off. Not lame on the right hind, but just off. And he's a pack horse for hunting trips. Adjusted atlas and sacrum first couple of times, still not level, still not quite right. So the third time I went out to see him, I did the inner transverse. And dang, if the guy didn't look from the owner looked from the back end, he's like, wow, he's level now. And we watched him walk off, and then he trotted up the hill. And I didn't do, he also told me he'd seen another chiropractor who was traveling through who used mallets, on the horse in between my second and third adjustments. But I guess the win there for me was that my third and hitting that inner transverse was what made Rico better, not the mallets.
Yes. Yes. So there's another big win that you didn't talk about. You kind of referred to it a little bit in your introduction, but let's talk about what animal chiropractic has meant to you and your family.
Right. Well, yes, that's right. That's like the hugest win. That's like the umbrella over everything. Gracelyn is 17. She's in her she's technically a senior in high school, but because of what Gunnison does with Western Colorado University, she's taking classes there. So it's her second year at the college. So very self-sufficient, but she needs a mom. And she needs a mom who isn't stressed out by not being able to heal animals during the day or answering the phone at night for emergencies when I was on call. So I was at a pretty low point as far as veterinary medicine goes. And this has just opened up a whole new, a path for me as a mom to still be present for Gracelyn. I always thought that I couldn't do veterinary medicine and be a mom. I could do both, but I couldn't do both really well. One or the other would suffer. So that's why I only did some relief work when Gracelyn was a little girl. And she would come with me to that clinic in Casper, and it was kind of random. It wasn't a lot. Because when I get into something, I give my heart and soul into it. And I think that's what happened the last couple of years here when I was at the clinic, is it was taking all of me, and there was nothing left for Gracelyn when I would get home at the end of the day. Animal chiropractic now is joyous, happy, and free. I am making a difference in these animals' lives, and it is not the frenetic pace of being on call at night and being woken up all night, having to answer the phone, being stressed out about what might be coming in, and like I said, not making a difference in those animals' lives. Now we have a much more measured pace. to everything. So I think that's what you mean by my biggest win.
Well, yeah, not only that, but you had a second job too that you.
Oh yeah. Okay, right. So after I left the veterinary clinic, yes, I went back to my human physical therapy roots, because you have to pay the bills somehow. And that was human medicine, home health / long-term care as a physical therapist, which is also draining mentally, and not fulfilling for the soul. So that was also not great. So yes, by doing this, I did just leave that position, and I am putting everything I have into Burnett Animal Chiropractic.
Yeah.
Right. Yes.
Mhm.
That's
Cool.
right. That was a big win.
All right. Well, we got to make sure we get all the big wins.
That's right. But
Yes.
there's so many.
Yeah.
There's so many. I mean, it's truly just amazing. Part of me is like, oh my God, why didn't you do this sooner? All those little voices in my head over the last several years, chiropractic, animal chiropractic. But maybe it wouldn't have been with ACEs. It would have been somewhere else, and then it wouldn't have been as good. So it all happens as it's supposed to happen.
Right.
Mm-hmm.
I was talking to somebody the other day. You said about ACEs, and it wouldn't have been as good. And she said, I would love to be able to compare ACEs to everything, to the other schools. And she said, I can't, because I only went to ACEs. And that's the only one I have. She goes, but all I know is that when I was sitting at the national certification exam, the ABCA exam, and yes, it was a tough exam, but when I walked out, I knew that I knew everything in it, that I had been exposed to everything in the test. And if I got one wrong, it was my fault and not because I hadn't ever heard of it before. And the guy next to me was literally sweating, and he's muttering, I've never seen this shit. I've never seen this shit before.
I shouldn't laugh, but
yeah. And so she said, I'm so glad that I went to ACEs. I can't compare it to anything else. That's my only comparative thing. But he had gone to a different school, and he was literally just sweating bullets over the test. And she said, I'm not going to say it was an easy test. I knew I had seen everything at least, and I had the knowledge to figure out the questions. Whether I got them right or I don't know, but I passed. So yeah.
Right. And the practical part of the certification exam, I felt like we were in the barn or working on Poppy, right?
Yeah.
For our practical, it felt the exact same way. It was set up exactly the same. It was like, oh, okay, I know how to do this. I got this. I guess my one comparison, and this, I don't mean to be tacky or petty, but watching some of the other students taking the practical, certain sections of it, well, I don't know how much you want me to, but standing on a bale in front of the horse to adjust an atlas, standing on the bale of hay right in front of the horse. I cannot think of a more dangerous thing to be doing. And I saw a couple of people doing that. Was that how they're teaching how you adjust an atlas?
I cannot say. I do know.
Right.
I do know that one of the things that we stress at ACEs is safety.
Yes.
Because we know that if you get hurt, you can't help any animals. So.
And then it's just also a poor reflection on an animal chiropractor if you're gonna put yourself in harm's way like that and get hurt as a result. It just looked incredibly dangerous. So I thought that was odd. And
I was talking to one of our students, and he had gone to a CE class and learned a new way to adjust the lumbar region in a horse. And he thought, well, that looks kind of cool. And so, but basically you lay on the horse and you adjust. And so he did it once, and he was so glad he was in the middle of an arena and it was sand because he thrust and the horse laid down.
Oh my God.
And he said, if I'd have been on my bail,
Yeah.
no big deal. The horse would
I'm
have laid
trying
down
to,
and
yeah, I'm trying to even imagine how you would lay on a horse and adjust a horse that way.
anyway, they did, and the horse went down, and he was like, I was so glad I was in the middle of the arena, and my bail wasn't anywhere close, so like I was just waiting for the horse to choose which way to go so I could go the opposite way. And
Holy cow. Holy
yeah.
cow.
But he said, yeah, he did that once, and he said it worked, but no, it's not worth it.
Well, and I guess maybe, I mean, I have had a couple of horses, right, who I struggle with getting their head down to be able to get the head down to adjust the atlas. So maybe standing on your bail in front of the horse would give you that, but whew, I wouldn't want to try that. So yeah, safety was a big thing I saw there at the exam that I felt was hammered home to us at ACEs, obviously. And was able then to translate that in every practical to the handler, right? Making sure that with every setup, you okay, this is where I want you, being able to talk them through it because we did it with you guys. So it was like riding a bike. And then just a couple of other things. It just felt like we were very well prepared for that part of the exam. The written, yeah, it was difficult. But I didn't walk out feeling like, yes, I had failed it. I had seen and was able to pick my way through the questions.
Well, and it wouldn't be a national certification exam if it was easy.
One of my clients told me that. That's what they said when they asked me how it was. And I was like, oh my God, it was so hard. She's like, well, if it was easy, then everybody would be doing it. So
right. Yeah.
All right. Well, I guess we'll know in a few weeks, huh?
Yeah. Well, yeah. So anyway, let's see. What would you tell other veterinarians? New veterinarians, older veterinarians, moms veterinarians. What would you tell mom veterinarians?
Well, that was kind of you. I used to tell mom veterinarians that, you can do one or the other, but if you try to do both, one's going to suffer and your child will grow up without you present mentally, spiritually, physically, emotionally. Well, maybe you'll be there physically some of the time, or your patients will suffer. They won't get all of you that they, or as much of you as you need. So when I talk to new moms, I pretty much tell them, pour everything you have into your kids because you only have this time with them once.
Right.
It was difficult for me to get back into veterinary medicine in a very busy practice with a large circumference, a large radius, I guess, or whatever, a large area that we service here. It was really difficult for me. And for moms that might have taken off the time like I did, who may think that then veterinary medicine is out of reach because how do you get back into it? How do you get back into that craziness of it? So in that respect, animal chiropractic care allows you to be a veterinarian, and it allows you to heal animals, help them heal themselves. It allows you to put your hands on animals and do the thing that you went to school for, right? Was to take care of animals. But without the pressure and the pace of a very busy practice that I felt like I was swimming in when I got back into it a couple of years ago. And it was a lot. So there's that. But then also with animal chiropractic care, I get to go to the gym every morning and early because I'm not up late on call or at the clinic at 10 o'clock or at midnight. And we have dinner every night together, Graceland and I. And I'm more present for her because with animal chiropractic care, I get to decide my schedule, and I can do what I need to do in the times that she's busy at school. We have time to go to her sword fighting tournaments, her HEMA tournaments, because I can dictate my schedule. And so I can work it around my child.
And one of the things that, yes, you can do that. One of the things, there's very few chiropractic emergencies. And if there is a chiropractic emergency as perceived by the client, we talk about it in class, charge appropriately.
Yes.
And the other thing is, do what we do. Don't get caught up in I have to give you a 45-minute appointment in order for you to get your money's worth. That's not what it's about. BJ and Dee Dee talked about the health pendulum and how we're always swinging one way or the other. And so if we're not healing, we're dying. And if we're not doing something towards healing, we're doing something towards dying. And so and we know that a vertebral subluxation causes decrease in neurotransmission within 4 minutes. We know that we start to get cartilage damage in a joint that doesn't move within 7 days, that sticks around for 7-8 months. So we know those things happen. So when we have a patient that identifies their animal as being subluxated, we got to get rid of it. And it takes less than 5 minutes to do that.
Yes. I will say that is something that I am really trying to work very hard on, is acknowledging my worth, and that my educational background, the things I have learned how to do, are worth money. And as I'm getting going, because I am getting busier, I'm getting more clients, making sure to value myself and my knowledge and my expertise, and then charge accordingly and keep it there, is a challenge. So that is like, I'm not even sure I could call that a win yet for me, because I feel like I'm still on that uphill climb. It's not that it's a battle for me, but it is a challenge.
So I just saw a dog, emergency, basically. The dog, the reason it was an emergency is because they didn't find out about us until Tuesday night. And so the only day that we see clients non-emergency are Tuesday from 1 to 6.
Right.
And we make it easy for people to come in because we do a free spinal exam. All right. Now that free spinal exam is worth something, but on Tuesdays from 1 to 6, because it's convenient for us, we give that away. And that's the only time we ever discount our prices. All right. So a spinal exam is worth $75 on a dog, and it's worth $125 on a horse to check the horse for vertebral subluxations, to check the dog for vertebral subluxations. So these people that came in today, they've had their dog off of drugs for 24 hours because they went to 2 emergency clinics, they've spent already over $1,000 on this dog. The veterinarian said two veterinarians said there's probably a problem in the lumbar region of this dog. Why are you laughing?
Might be a little higher up.
So we were getting this paralyzed dog out of the car. And of course I got the head, and my hands go to the space between the ramus of the mandible and the wings of the atlas. Well, I was in front of the dog, so I couldn't adjust.
Oh, okay.
But yeah, And the space between the ramus of the manimal and the wings atlas, for you listening at home, it's a little bump right behind your dog's ears before that first cervical vertebra. There's a little bump there, and it should be bilaterally symmetrical. It should be the same on both sides of your dog's neck. And if it's not, it is impinging on nerve flow. And yes, it's up there, but then there's this thing, there's these 5 guys that show up whenever we have this bone that doesn't move right. And you guys all know there's 5 ladies, 5 guys. Think about your church group. Think about the local bar, maybe the road, but there's 5 guys that are always there, right?
Yeah.
Yeah, you can picture them.
Oh, yeah.
All right. Well, the 5 guys that show up in the spine whenever we have no movement, they're called sharp. They're swelling, heat, loss of function, redness, and pain. And loss of function is ardor. So sharp. And I explained that when we have this swelling, it drops to the bottom. And I have an atlas, and it shows with a key ring in it. And when you hold the atlas up, the key ring goes right where the femoral nerve or the stand-up nerve is on these dogs. And so I said, if there's any swelling, what's the first place it's going to go? And he points right to the femoral nerve. And I said, yeah, right there. And that's the stand-up nerve in the back end of your dog. That's the first nerve that goes when this happened. And he was like, wow. And I said, here, you feel. I had 2 inches of space on one side between the ramus of the mandible.
Wow.
It was literally the worst. I was like, oh my gosh, I wish I would love to take an x-ray of this dog,
right.
But I'm not going to, because that's that much more time this dog's pendulum is going towards death.
Yeah.
So let's get this adjusted before I even talk to you anymore about it. Here, I'm going to fix it. Now feel. And he said, oh, well, those are almost even now. And I said, yeah, they are almost even. And so, that's the dog's problem. And he was like, wow, that makes so much sense. When you first said the problem's up here, he was like, no, it's back here. It's this end's not working. But now he's in for, and then of course, he's a young man, he's married, and he does have a favorite adult beverage, which is always,
right.
Which is good. And his wife has a favorite adult beverage too. His was whiskey and hers was tequila.
Okay.
And so I explained to them how, and she gets home first. So we decided when she gets home, she's going to make a whiskey and put it in the freezer.
Okay.
In a baggie. And then when he gets home, he's going to put it on the dog's neck.
Very good. And then he can drink it when it's melted. When
it's almost too warm to drink. Yes.
Right.
Yes.
Right.
And then he's going to put a margarita or a tequila in and then a couple hours later, he's going to remind his wife to ice the dog.
Yeah.
And this weekend, this is Friday. So I don't know what day this is going to air, but this was a Friday. And so tomorrow's big football day, right? Big football games.
Yeah.
And so I asked him if his team was playing. He said, well, there's a couple. And I said, okay, well, so during the game, if your team's winning, you can ice the dog more. If your team's losing, he goes, my team's losing, we'll definitely ice the dog more. And so I have no doubt that this dog is going to get iced properly this weekend.
Awesome.
For inflammation. And then we're going to see the second visit on Tuesday. So yeah, but and what are the side effects of ice?
Well, good side effects.
Yeah,
decreased pain, right? Decreased inflammation, decreased blood flow to the area to kind of slow everything down. It's going to make the dog feel better.
Yeah, and without the side effects, like a muscle relaxer. One of the things that a lot of people forget is when we relax, when we use a muscle relaxer, it relaxes all the muscles in the body,
right?
Including the heart. The diaphragm and the gut. So yep, all those muscles will be relaxed. And is that a good thing for your dog or a bad thing for your dog?
No, right?
Yeah,
I'm surprised, and that was one of the things too. I just did fill in at the vet clinic that I used to work at. Just this last couple of weeks, I did a couple of days there, which helped me remember that this was a really hard place to be. There's a new shot out there.
Starts with an L.
It does.
Avoid it.
And one one of the techs wanted me to use it on a dog, and I did not, because one, I haven't used it, but just the night previous, I had talked to someone whose dog was given
That
that
shot.
shot and another injection, starts with an A, for joints. Same time, 12, 13-year-old little terrier thing that was having some trouble in her back end. And when I talked to her, the dog was now paralyzed and wasn't walking, and had been like 5 days, 6 days since that shot. So I don't think I'll ever be using that. And what could have happened, so I did then give this woman the information about how to go search for an AVCA certified animal chiropractor in her area, and sent her that link so that she could find somebody to take now her paralyzed little terrier to start her back on that pendulum towards living and not dying.
Did she find you?
This was my online
Oh, okay. All right. Yeah.
job. Yeah. So no, she didn't find me. She's in Virginia, unfortunately.
Yeah. Okay.
Too
Well,
far
cool.
away. Mm-hmm.
Yeah.
Mm-hmm. But just
And-
sad that's kind of the paradigm, right? That you said muscle relaxers, it made me think of that. We give out gabapentin like it's candy, and for pain,
And the number one side effect is ataxia, or looking like your dog is drunk.
right. And it's like he's not getting up. He couldn't get up in his hind end, and now he's worse. Of course he's worse. He's drunk.
Yeah. 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 So just so you know that I include mine. I talked about that shot at the American Bovine Practitioners,
You did?
and only 5 people got up. So I must not have been. I must not have been adamant enough about it, but basically I told them there's 3 different labels on that drug. The US label says that, maybe some kidney issues. The Canadian label says that, well, death is possible. It doesn't really come out and say how many, but if you read about how Canadian labels are worked,
Right.
there's systemic problems that you could see with this thing. It's anorexia, so they don't eat; lethargy, they lay around; death,
Right.
or seizures. Okay, those are some systemic issues you might see, and seizures occur in 3.4% of the dogs, and side effects are listed from most to least. So death occurs in more than 3.4% of the dogs. All right.
Yeah.
And that's Canadian. And then the United Kingdom label, the England labels actually says that there was 2 dogs out of 100 that had to be put to sleep before the trial was even over.
But it's being touted as the latest, greatest thing.
Yeah.
Which is so incredibly frustrating. And I have to be really careful when
you
I'm,
work.
yes, when I'm in different capacities, different roles, different hats I'm wearing. I have to be very careful. But so you were talking about the dog, and you were at the head and you feel it. And I cannot tell you how many dogs I walk by, and that's where I go immediately, right? I'm just like petting them or talking to the owner, and I'm checking the space between the ramus of the mandible and the wing of the atlas. It's just like automatic. I go right there.
Here's my card. Here's my card.
Right.
Here's my card.
Yeah. Call me. Your dog needs you to call me.
Yeah.
It's like habit now.
Yeah. Well, that's cool.
It's a good habit.
Yes. So, we're trying and trying more to get, chiropractic recognized as a treatment modality for veterinary medicine, so that veterinarians don't just brush it off and blow it away and say,
Yes.
hey, don't do it, because, I know one of your jobs is you do some call-in veterinary work,
Yes.
where people call in and then you talk to them a little bit and say, yeah, that's an emergency, or that's
Right.
normal, or, hey, maybe you should go find a different veterinarian, or
Yes.
I do know you're saying, hey, go find a chiropractor in your area.
A lot. I say that.
Yes. And so, but the problem is that when you're not answering the phone,
I know.
nobody's doing that.
No.
And when, and when you're not at the clinic, and we have a lot of students that still stay with both hats on,
Right.
but a lot of them, I know at least 2 doctors that when you sign your intake forms, it says right in there that Dr. Y is going to check your dog's atlas and adjust it if it needs it. This is going to happen unless you say no.
Unless you say no.
Yeah.
I'm trying to get, I don't know if I'll be asked to fill in anymore, at my old clinic. And it was, I had a non-compete, and we're still sort of working through feelings about that. So I would love to get it to that point, because there were so many of the 3 days that I worked, I'm feeling every atlas, right? And I'm running my hands down the spine, and I'm like, oh, I could adjust this dog. But it wasn't discussed prior to me being there. But I think something like what you're saying with the intake form, right? That this is going to happen. And do they charge for it then?
Yeah. Yeah. They upped their exam price by $25.
Okay.
And every dog gets its atlas checked. And
Wow.
then a lot of people ask what you're doing.
Mm-hmm.
And then that turns into a full-blown chiropractic adjustment, which is extra.
Right.
And then a lot of them become chiropractic maintenance
Right.
patients, which
Right.
for a veterinary clinic is a huge deal, because as veterinarians, we see most of our dogs once or twice a year.
Correct.
We see most of our chiropractic patients monthly.
Mm-hmm. Mm-hmm.
And so it does 2 things for us. One, it's evens out our stream of income.
Right.
And 2, it helps us identify things quicker.
Right.
Maybe identify some medical problems that if we hadn't seen for 6 or 8 months, would be an issue. Like, hey, your dog's got a mass here. I didn't notice that last month.
Right. I'm going to send him over to the room next door.
Yeah.
And we'll have Dr. Y do a fine needle aspirate cytology on that.
Right. And you're going to find it when
check
it's
that
small,
mass.
when it's small enough to do something about.
Correct.
Because
Right.
if 8 months, that thing might be huge.
Right. Right.
But we're going to find it.
That's a really good business model.
Mm-hmm. And triage, because there are so many animals that we adjust that I have to, a lady in her unwillingness to wait 3 days, 3 visits,
Right.
3 visits, she cost herself $400 worth of x-rays.
Ugh.
So the first visit was on a Tuesday. The second visit was on a Saturday. Students adjusted, and she was supposed to come back on Tuesday, but it was a big dog and she couldn't get there, and yada, yada, and all this. And she said, I don't know. And she said, well, I'm getting x-rays taken tomorrow at noon. I said, well, I'm open, so we'll just stop by after you get the x-rays taken.
Mm-hmm.
And so she got anyway, they got there, and how's the dog doing? Well, man, he's not walking yet, but he's doing amazingly better. He's pulling himself around on his front legs, which he was just laying there when we started. He's eating well. In fact, this morning he pulled himself over to his favorite chair. Put his front. This dog's like 80 pounds, right?
Oh my
Pulled
God.
himself over to his favorite chair, put his front legs up in the chair, and then he said he just kind of looked at us like, a little help here. I could use a little help here. And so they helped him up into his chair, and he's sat there for about an hour or so, and then it was time to go, and they were getting ready, and he jumped out of the chair, and his back end plopped out, and he drug himself across the floor, which when we started a week ago, none of that would have happened. They had to literally carry this 80-pound dog in.
Wow.
So now they're willing to go a little bit even. They're like, well, I said 3 visits, and we'll see if it's working or not.
Right.
Is it working? Yes, it is. And we can live with him at this point. If he doesn't get any better, he's happy. He's not peeing in the house.
Right.
He's not pooping in the house. We're not killing ourselves carrying. He said, when either one of us tried to carry him out of the house, it was not happening.
Yeah.
And but now he's, doing better. And so we're ready to go. And I said, well, we're probably going to do 3 weekly visits now.
Right.
And then we'll see where we're at.
Which would have that's equal to the cost of the x-rays.
Yeah.
3 weekly visit. Right.
Yeah.
Which probably didn't show anything, right?
I haven't seen them yet.
Oh, okay.
So I'm guessing maybe they did and they don't. But see, I had them take the x-rays they took when the dog showed up were pelvis and lumbar. And I asked for the other end of the dog.
Atlas. Yeah.
Well, lower neck too, because this dog could have some lower neck issues, as well as an Atlas. But so I asked for the other end, and maybe they saw something, and so now they don't want to send them because it'd be like, well, why didn't you take those day one?
Right.
So anyway, it is all right. How do I get a hold of you if I need my dog adjusted or my horse adjusted?
Yeah, Burnett Animal Chiropractic.com. Burnett, animalchiropractic.com. Or search in Gunnison, Colorado for an animal chiropractor. And my site should come up, but you can check out the website. There's a phone number on the website to call or send me an email and it'll get to me. So dogs, cats, and coming soon, cows, llamas, pigs, turkeys, goats, sheep, rabbits, even.
Rabbits. Yep.
All
kinds of food animals.
Yeah, I'm doing the food animal course in a month or 3 weeks. I am so excited.
And bucking
I tell
bulls.
everybody about it. And there are a couple of, we'll be right smack in the middle of preg checking when I get back from that course. So there are a couple of ranches here in the valley who kind of subscribe to a more grass-fed, grass-finished. I think they're certified organic. I'm not sure, but very local, little local ranch here. Don't send to feedlots is where I'm headed. They're very much health-minded, right? So I'm going to go reach out to them in the next week or so to ask if I can, after preg checking, go through the cows and do some adjustments. And I was actually also thinking about offering, we run a little experiment, right? Do some of them and not some of them and see how they end up at calving time.
Well, we know that there's 83%. So, we know that we can improve second service conception rate. So, the time to do it is pre-breeding.
Okay.
And then we also know that we can teach them some things how to check to make sure that they don't need that would like pre-calving to make sure that, look at tuberous sacralis. How hard is that in a dog? Well, if we look at those tuberous sacralis and they're not straight across, we know the hole's not optimal.
Well, and I guess I was thinking, following the cows in the chute, getting preg checked, can I do it at the same time, get them then, right? And start getting them thinking that this would be a good person to have out throughout the cow's life, right?
Yes, at birth. And
anyway, totally excited about the whole food animal course. Can't wait to come.
All right. So everybody, thank you for listening again. Remember, the body heals one way only, above, down, inside out. Keep those atlases adjusted.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.